Welcome back to Clinic Success Secret. We're uncovering the strategies and insights that drive clinic growth and excellence in patient healthcare. Join us as we dive into expert advice and success stories from healthcare clinics, and leaders in the space. Today, I'm excited to be chatting to Rebecca Weiss, a pioneer in the space of enabling the next generation of healthcare providers in starting their own businesses, as well as having over 2 decades of experience with dedicated service. Dr. Weiss is both a board-certified physician who's passionate about proficiency in the art of cosmetic injectables and advanced laser skincare, as really put her into a league of her own when it comes to being a leading expert in medical aesthetics. I'm sure we'll be diving deep into today, the founder of multiple different businesses in the healthcare space. So beyond being the visionary of Tonic, she's been everywhere when it comes to starting new medical practices. So that being said, it's an absolute pleasure to have you, and thanks for joining today, Rebecca.
Thank you so much for having me on the show. Appreciate
it. So Rebecca, let's jump right into it. Would you like to add your own introduction to what I said there, and maybe you can correct anything I said or update anything, and let people know who you are?
So, yes, I'm a board-certified physician. I specialize in cosmetic injectable treatments, cosmetic medicine in general, as well as primary care. I started off in primary care, and over the years, I've got about 20 plus years experience now. Over the years, I've owned various practices, both cosmetic and primary care practices, and have just, I've had successes, I've had failures. I have an entrepreneurial spirit, so I'm willing to try things that maybe others are more timid about, but I really enjoy working with other providers, and have gotten to that point in my career now where my focus is in trying to assist mostly cosmetic injectors in opening their own practices. So empowering them to become entrepreneurs themselves, and really giving them the tools that they need to be successful in cosmetic medicine.
Brilliant. Can you tell us a bit about how you got into this? You alluded to the entrepreneurial kind of mindset that you have. How did that jump into working for yourself originally?
So in going through medical school and my training in residency, my focus was really on the clinical aspects, learning all of the important clinical aspects of medicine that I needed to know to deliver really excellent care to patients. And I really wasn't thinking in terms of owning my own business, what that would look like. I always figured I would work for someone else, or work for a hospital system, or another provider practice. I didn't really consider the option of owning my own business until a little bit further along in my career. Once I think I felt more comfortable with the clinical side of things, and in kind of reevaluating my own priorities for my career, I realized that there's challenges. There's challenges to working for someone else, and there's challenges for working for yourself. But I felt like the benefits for that come with business ownership outweighed the potential downside. And I think some of that was just naivete. I didn't know what I didn't know at that point. I just thought I had a really great idea and something that I really was passionate about, and it didn't ever occur to me that I might fail at that. And luckily, that business, which was the first business I opened, is still in existence today, and I'm still working there. So that is great. That's 16 years later. But again, I think some of it just, I took out a big loan, and I didn't really think twice about it. And that luckily has worked out for me. And I've been able to open other practices since, some of which didn't become successful. So I am happy to share both my successes and failures with people, colleagues, because I think better to learn through my mistakes than to make them yourself. But yeah, I had a lot of help. Again, as a clinician, I think really where our focus should be in the beginning is really learning how to deliver excellent clinical care. So I had help behind the scenes. My father was an accountant, and my husband has an MBA. And so I was very lucky to have people I could fall back on to ask questions about. I didn't know what a pro forma was. I didn't know, what projections for business projections and goals and all of those things really look like. I just knew I was passionate about providing these services, and it wasn't for a while. You have to learn those things as you go. And so, yeah, it was a steep learning curve in the beginning, but I really enjoyed it. So I don't regret a minute of being a business owner. Even though, like I said, I did have one business fail, but so did Donald Trump, Brett. He's a he's gone.
It worked out all right for you in the end, yeah. So sure, you should go for president anytime soon. Just give us a heads up. So obviously that worked out well for you.
Yeah, I mean, I feel like, sorry to interrupt you. I just feel like when I was working elsewhere, it was really a volume-based situation where I was seeing lots of patients each day, really just trying to keep my head above water. I wanted, again, to be able to deliver excellent care, but it's really difficult to do that, I think, when you're tasked with seeing 25 patients a day. And I think, beyond just the clinical care, there's also insurance dynamics that have become more and more complicated. And I think just trying to navigate all of that became extremely difficult and disheartening for me as a provider. I was still fairly new in my career at that point, and it just saw the writing on the wall that I didn't see myself sustaining that level of like just running around and again trying to stay afloat for years to come. So I knew I had at least 20 plus more years of career left in me, and I didn't think I could do it. So I thought, well, if I want to do it differently, I need to do it for myself.
That's obviously very insightful. There's a few questions I want to ask specifically about the lessons you've learned, but just circling back to that point, Rebecca, the point is the fact that you were managing 25 people a day. You're obviously running up the walls, not a spare moment to breathe. I'm sure, obviously, that's a very common situation for somebody that wants to start, a clinic themselves. How do you find that space? There's obviously that limbo period, that transitionary period where you're saying, I want to stop working for someone else, I want to start working for myself. Okay, you just stop sleeping. I'm not saying you should do that, but how did that look?
Yeah, I had to, it's not like just one day I flipped off a switch and flipped on another one, right? So it took a lot of thought and planning to make a strategy for what is it that I wanted to do, right? And how was I going to do it and be successful at it? So I do think, before you open a business, there's sometimes years of time you're thinking about it and strategizing what your plan is going to be. In my case, I was working primary care and had actually been a patient at a cosmetic practice. So full disclosure, I was getting Botox, and I thought, I just had this epiphany. I'm sitting in the waiting room and I'm thinking, you know what? I'm really good. I love doing procedures. I feel like that's a skill set that I have, and I could certainly get trained to do that and do it well. And so, it took me about a year training, because you don't learn those skills as a primary care physician. So I had to seek out mentors and take lots of courses and practice on all my friends and family and make sure that my skill set was up to par before I ever even considered opening my own business doing that, right? So that didn't happen overnight. But once I felt like I was ready, then my original plan was to stop doing primary care altogether and transition exclusively to aesthetic medicine. I partnered with another board certified primary care doc, and she's very interested in bioidentical hormone therapies and wellness services, acupuncture, weight loss, that kind of thing. So we sort of pulled our plans together, and that partnership has worked out very well over the years because we share a lot of patients. And I think there's a lot of nice back and forth there, but we can both really focus on the services that we feel the most passionate about. So that's what we did. So we were actually both working at that same practice previously, and we planned on days off, got together and strategized, and eventually, pulled the trigger. And like I said, we took out a big loan and found a space, built that space out to our configurations that we felt we needed, and made it happen. And it took a while, and it was also in 2008 when this practice started. So if you think back on 2008, like the bottom, like the financial situation in 2008 wasn't so great. Everything, like, sort of the bottom dropped out, and a lot of people were really struggling. We had already started construction on the site in 2007, so we were already knee deep, and we weren't going to stop at that point and redirect. So we just moved forward, and I think the financial downturn that happened didn't affect us as much because we were new anyway. Maybe we would have been profitable faster had we opened it another time. But to my dismay, it took longer than I thought to be able to pay myself. First thing, we had employees, right? So I have to pay my employees to be here. I had to have equipment and supplies, and those things come first. So it took several years really before I started earning a living doing medical aesthetics. I think if you do things a little bit differently, I opened a 2,000 square foot office space. I think if you do things a little bit differently, maybe you don't take on so much, you can become profitable much faster. And that's kind of where I've pivoted in my career, is helping people kind of understand that and make that happen for themselves. But at the time, again, I didn't know what I didn't know. And I was working other jobs, urgent care, those kinds of jobs to make ends meet so I could bring some money home to my family while working and building up the medical aesthetic practice. But then the space next to us became available in 2009. And we thought, well, why are we working for other primary care practices? Why don't we open our own primary care practice and maybe do that practice a little differently than the previous primary care practice we were at? So about a year and a half later, we opened a primary care practice next to the cosmetic and wellness practice. And again, that's really helped. When the financial situation in the world isn't great, people still need primary care. So while they may not be spending as readily on cosmetic services, though I do think, I don't want to say that cosmetic medicine is recession proof, though that term does get thrown around a lot. I do think people they prioritize in times like that. But I think we all want to feel good and look good. And so, you may not buy expensive Louis Vuitton bags or something, but you still get your Botox, because once you've had Botox, you never not want Botox. So it is a bit addictive in that way. And you want to keep, again, looking and feeling your best. So I don't, like I said, I don't want to say that we would have seen no patients, but we probably grew a little more slowly, and the primary care practice helped us float that boat for a while we were building up the cosmetic practice. We were able to be earning money at our primary care practice. And so we still have both of those. So we have Paradise Medspa Wellness, and then separated by, it's like in another, it's right next door. There we connect the break rooms, but it's a separate waiting room and a separate business name. It's called Norterra Family Medicine. And so that practice has now been open for 15 years. And we've learned some things actually a few years back. We got to that point where we had grown so much over 15 years at the primary care practice that we had 9,000 active patients. And we were starting to see that writing on the wall, kind of like our first practice where we were seeing 25 patients. We were getting up there. And I think we were seeing probably 20 to 24 patients a day. And we said, we're not going down this road again. We left that scene to do it differently. And we really needed to figure out how that was going to look for us moving forward. And so a year and a half ago, we transitioned that practice to a concierge model, which we can talk about. But I do think it's a struggle, I think, for a lot of primary care practices because there is a shortage of primary care docs. There seems to be no shortage of people that want to get into cosmetic medicine, but there is a shortage of primary care providers. And in our area, anyway, most of the primary care practices are owned and operated by the bigger hospital systems. So it's hard to be an independent practice. We get offers to be purchased all the time by those groups. They want to, there's a lot of consolidation happening, but we didn't want to be that. And so it was a little scary to make that transition to concierge medicine, but it's been actually really fabulous for us. And I think our patients are really happy about it.
Definitely lots to unpack there. There's a lot of ways I'd like to go with that. I definitely would delve into the different models such as concierge medicine and all that. But just to round up what you were saying there, if you're a start all over again, right, and you're currently working for someone else, would you do it all the same again? I know you've talked before about the importance of, you mentioned that you had one venture that maybe didn't work out.
Mm-hmm.
You talk often about the importance of your start small approach with regards to, being picking one specific vertical. Would you recommend that? Would you recommend building a primary care clinic first, or if you to roll back the clock?
Yeah. Well, I guess at the point that I made my choice, I was so disenchanted with primary care that I was like, never doing this again. But a year later, I was doing it again. So, life happens. But, I think a couple of things that I did right. One is that I purchased the real estate for the business that I'm in, right? So that didn't look good at first because then, the housing market collapsed, the real estate, everything kind of dropped. But now looking back on it, here we are, 16 years later, it's actually really good to have that real estate as an asset. But that's partly why my loan was so large with the SBA, with the Small Business Association, because there was property involved. But what I did do right is I didn't buy every laser. I didn't feel like I needed to be all things to all people. Like I really tailored my service offerings to just a few things, or I would buy a laser that has multi-platform, so you can do several different treatments with one device. And I just didn't have enough money to be able to buy all these different devices, which a lot of them are, even back then, were north of $100,000 a piece, and they've even gone up since then. So I think that was a good strategic move. And that is what I tell people that I work with, is to, pick a couple of key treatments that you feel, one, you're passionate about providing, and the efficacy and the safety and all of that is there. And then what is depending on where you're opening your practice, what is the need in your area? I mean, if there's a million laser hair removal places that are, super discounted laser hair removal, and it is that way here in Phoenix. Maybe hair removal isn't what you want to offer. Maybe do facial aesthetics, maybe focus on injectables, maybe just a couple of key treatments in addition, microneedling, and you can get a microneedling pen for $5,000. You don't have to spend $100,000 on that. Maybe it's a photofacial device, an IPL device, or something like that, to address photo damage, something So you are addressing the skin. I like to say aging is a multi-tissue issue. So just injectables may not be enough. You may want to do some other things to reverse some sun damage and improve pigmentation on the skin, for example. So, pick a couple key things and then focus on that. Get really good at those things before you then add to your repertoire. The difference between primary care and cosmetic medicine is very device-based, and injectables are very, you've got a lot of supplies. There's a lot of cost associated with those things that you need to have in order to provide cosmetic services to patients. Where with primary care, it's really more your expertise. You don't need to have a bunch of devices in a primary care practice, right? Patients aren't coming to you for that. They're coming to you for your expertise in primary care and your opinions and your treatment recommendations. So it's a lot less expensive to open a primary care practice than it is to open a cosmetic practice. In general, you may need more staff. You may need to be paying for billing staff, which we had at our height when we had all of those patients and we're running everything through insurance. We had a whole team of people and even had to outsource some of it just to bill for the services we'd already provided. So that was a challenge where you don't have that in a cash-based business. So, the staff, you can start real small with your staff at a cosmetic practice. You could be a one-man band. You can do it yourself. And that's really where I'm providing mentorship to mostly nurse injectors at this point with my company called Tonic. And that is a company where we mentor nurse injectors, and we guide them into owning their own Toxin Tonic location. And how does that look for them? And help them find a suitable location. And not only provide clinical, that's really my role, is to help them to provide clinical mentorship, but also business mentorship. And we provide marketing services and all of those things so they can focus on just being really great in cosmetic injectors. So, yeah, it's a lot.
It's a lot. And we'll dive into the Toxin Tonic business model shortly, because for anyone listening, check out toxintonic.com. It's one of the coolest websites I've seen in a long time. You did a great job with the branding. Circling back, you mentioned the concierge care and the differentiation between that and the traditional model and direct primary care.
Direct primary care, yeah.
Exactly, and the nuances, which might give us a bit more information about what that looks like.
Yeah. So, in addition to all those other things I do, I am a partner in a direct primary care practice. I don't see patients there, but so there are some important distinctions between different care models when it comes to primary care practices. You've got your traditional insurance-based practice where you come, you might pay your copay, you might pay towards your deductible, but all of the services are being run through whatever insurance plan you have. Although if you don't have insurance, we still see you. There's just a cash rate that we charge. We also take Medicare. Some offices take Medicaid. We don't, but we do. Our patients are aging along with us, and so we have a lot of patients who are on traditional Medicare or these Medicare alternatives that are available now. So you've got that model. Unfortunately, that model, it's very challenging because, like I said, there's all these regulations by the insurance companies, mostly driven by Medicare, where they are trying to collect information. So, there's like goals that they want you to meet. They want to make sure that all of your diabetic patients have their sugar levels controlled to a certain level. They want to make sure that all of your high blood pressure patients have their, blood pressure controlled. I think these are good measures, but it adds a layer of complexity because not only do you as a provider want to meet those metrics, but you also have to prove it to the insurance company. And sometimes that can be difficult. That's all through coding, how you code and how you bill. And and they control a lot of that. So, even for prescription plans. So if you prescribe medication X, the insurance company may or may not cover that medication. So then there's the potential for prior authorizations that your staff has to spend time trying to get that medication for the patient. It takes a lot of time. And sometimes they won't cover it at all. And so then you have to come up with an alternative, or they won't cover the radiology testing that you've ordered. And you, as a clinician, feel the patient needs this, right? We don't order things that patients don't need. And so it just becomes very challenging, all of those dynamics. And because of that, you often aren't getting paid for the work that you do. And if you are getting paid, you're getting paid way in the rears. So sometimes, 90 days later, sometimes longer, before you actually get reimbursed by the insurance company for the service you provided 90 days ago, right? So it is a big challenge. And because of that, you end up having to see more and more patients in order to be able to support your practice, to be able to buy supplies such as vaccinations, pay your staff. You have to pay the people who are billing for you. There's just a lot of dynamics that make that increasingly more challenging. And so there are many primary care providers who've either just sort of like ditched the towel. Like they allow themselves to be purchased by a big hospital system, because then the hospital system can take care of all the billing and deal with all of that bureaucracy so that they can see patients. But guess what? The hospital system wants to make money. So they're going to make you see more and more and more patients, because that's really what's important to them, the bottom line. Obviously, they want to give good care, because it doesn't help them, if word gets around that hospital system X gives horrible care. But ultimately, they need to pay their CEOs gazillions of dollars, and that's how that works. So, you can choose that, or you can choose one of these other models, which I think are growing in popularity. One is concierge medicine, which is what we chose to do for our practice, where we charge a membership fee, an annual membership fee that could be split up quarterly. We also will bill insurance, but by virtue of being a member of our practice, you get access to services that aren't covered by traditional healthcare plans or Medicare. You also, because we're seeing fewer patients, we had, like I said, we started with 8,000 to 9,000 patients. Of course, not all of them are willing to pay a membership fee. So just by virtue of doing so, we are seeing much fewer in terms of the number of patients. And that hurt, that was a hard transition to make, to say goodbye to patients that we'd seen for years. Though our more medically fragile patients, the ones who have, higher acuity, higher needs, we do provide scholarships for them to stay with the practice without paying the fee. But, we went down, we're now seeing, when we include maybe the children of members and our scholarship patients, we might have 800 patients. So, we went to like 10%, and that's typical for a practice transitioning from traditional insurance to concierge. You're going to retain about 10% of your patient population. But what that has allowed us to do is give really good care and spend time with patients that need it, and provide just better access. If you're sick, in the past we were referring you to urgent care, we couldn't get you in today. But now we can make room for a same day patient. So when you're sick, you can actually get in and see someone. And that's been great. And I think it has restored for me, and I think I can speak for my staff, the other providers, certainly, that it has sort of restored the joy that we once had in providing primary care service, that we were losing in the other models. So, so I think that while there are challenges associated with it, I think it's been really great. And I think, our patient satisfaction has increased significantly since making that change. There is another model called direct primary care. Direct primary care, typically you don't take insurance at all. And you charge, in most cases, it's a monthly fee, monthly membership fee that's a little lower, but all of the primary care needs are met. by the end of the year, you may have spent the same as what you would have paid to see a concierge physician, but you're paying that monthly instead. And by virtue of being a member in one of those practices, typically all of the services that you can get within those four walls of that practice are covered by that fee. So they don't bill insurance at all for any of those services. It doesn't mean to say that patients don't need insurance, because they do. They still need to have a plan. One, if they had an accident or they became seriously ill, they need to have catastrophic coverage. But they also may want to have coverage for their medications, labs, radiology, or when they see a specialist who maybe isn't a direct, specialist that they can just pay a cash rate for. So, I think most of the patients seen in direct primary care do have insurance. It's just that they, when you really explain the financial dynamics of most healthcare plans, I don't know what it's like by you, but here, Tanya, different by you. But here with insurance, oftentimes people have deductibles. They have to pay out of pocket up to a certain amount before their insurance ever even kicks in. And that might be $5,000 a year. And that's pretty typical. I would say most people have like a $3,000 to $5,000 deductible on their plan. That might be for their whole family. It might just be for an individual. And so the majority of patients each year are not meeting their deductible unless they have had a hospitalization or a big procedure or something like that. So the fact is that we're all paying out of pocket for our services all the time. It's just going towards your deductible. In the case of direct primary care, that wouldn't go towards your deductible. So you wouldn't be, maybe getting closer to meeting that deductible amount towards the end of the year, but you're probably going to pay less in total for the year than you would if you were choosing to go to a practice that took your insurance and charged you for the office visit against your deductible, if that makes sense. So you might, for example, pay $1,500 or $1,800 a year to go to a concierge doc or primary care doc, direct primary care doc. But you're not, I think if you, depending on how often you actually see your doctor, it could really add up. And if you were being charged each time, so with direct primary care, you're paying that monthly fee. It doesn't matter if you see your doctor 10 times during the month, or if you see them once, or if you see them every other. It doesn't matter. The same. So I think it also helps you balance your finances too, because you know what you're going to spend on your primary care service. Where when you're just paying as you go, you don't have that stability. So I hope that explains that. It's all very confusing, and but I do think that all of these things are helping to, one, be able to provide care. Yes, to prevent burnout. I think for providers, but also I think patients are burnt out too. They're burnt out feeling insurance. Just the scene it's so challenging. It's so that not only are you paying for your $5,000 deductible each year, you're also paying for your insurance plan. And that can be, $250 to $500 a month could be more, depending on how many people you're insuring in your family. So it's challenging. And I think, for me, it's a little easier to have those discussions with patients because I do have a cosmetic practice. I do have a cash-based practice. And so talking about expenditures like this towards medical services isn't new to me. But I do think that a lot of traditional physicians, clinicians have difficulty having those conversations with patients. They don't want to talk about money because that's what we're taught, like in school, right? Your focus is there to provide clinical services, and it isn't about the money, but it has to be at some point. Like, in order for me to have this practice for you, I have to make money, right? Somehow I have to pay my staff. I have to pay the rent. So I think getting comfortable with having those conversations is also something that I provide mentorship for when I'm working with other providers.
I think I definitely want to dive deep into what you do in Tox and Tonic and all that. And before I start though, how are you set time-wise? Okay, cool. I want to dive into that. But to round up the point about direct primary care versus concierge and so on, what are some pitfalls that clinic owners may encounter when making the transition from the traditional model to either direct primary care or concierge care for their patients?
Well, one is the challenge of disclosing this to your patients, right, who aren't used to or may not be used to these different models, and having that conversation to say, listen, I know I've been your doctor for 10 years, but we're transitioning the practice to this new model. It does require a membership fee, and the membership fee, is $1,800 a year. And patients will like, what? Like, I've never had to pay that before. But what our goal is in making this transition is to be able to provide a better level of care than we're able to provide to you now. And that's important to us. And just being real with patients, I think that they appreciate it. And there were some patients, don't get me wrong, that felt like you're just doing this to make more. That will happen. But I think you just have to understand your why. Like, why are you making this transition for yourself and your practice, and why it's important for patients, and patient safety is really important. And I don't think that we have enough time to be able to think through all of the factors when someone comes with a medical problem. I mean, there's a whole host of things that it could be, and in 5 or 10 minutes, it's really difficult, for a provider to. I mean, sometimes it's easy, right? You have strep throat. You look in your mouth, you've got strep. But sometimes it's really challenging, and we live in a day and age where people are very, at least in the United States, very litigious. So, there is also the threat of lawsuits if you miss something, and that has happened to us. So, that was another, I think, motivator for making this change. Like, we need that time with you, and yes, it's going to come at a cost, but it's going to be worth it. And you just have to take my word for it. Maybe give us a chance and try us out for the year and see if you feel like there was value in it. I mean, they're spending, I'm sure, like $1,800, at least where we are. People can afford it. It's just a choice. Is it important to them? And it may not be important to everyone, but the patients that we've retained, it is important to them. And so I just think knowing your why is really important, and being transparent with your patients. So that's a bit why I just think the challenge of the discussion is hard. And then, I think there's other things too. It's like staffing. Staffing is always a challenge for business owners. But when you are transitioning to a concierge model, part of the goal is to give this really amazing patient experience. Again, that's part of the value of what they're paying for. And your staff has to be on point. You need to be able to recognize who in your staff can handle this transition and who can't. So that's hard too, because sometimes you've had staff for a long time and they're just not going to make the grade. And you've got to be willing to cut that cord with staff who just can't even themselves make that mental leap into having those conversations with patients. And in traditional medical practices, most of the staff, they're not comfortable and prepared to have conversations about membership fees and other things. So I think it's about educating your staff and being able to recognize the staff that are going to be able to add value to your practice, and the ones that won't, you just gotta let them go.
Perfect. That's a great way of rounding it out. I think I want to touch on Tonic and work you're doing there. Tell us about it. What do you do? What's the mission?
So Tonic was sort of a brainchild of mine that came after, like you said, I had a business that failed. And that business failed because I fell into a trap that I tell people not to fall into, which is to go too big, too soon, too fast. And I had opened a practice on another side of town, which, I thought I had enough name recognition in the area that people would recognize it as just another location of Paradise Medspa Wellness. But it was also geared more for men. So I think that maybe I muddied the waters there with trying to do too much and maybe do it a little bit differently. But I also felt like because I have an existing practice, which at that point had lots of service offerings that I needed to mirror that in this new location. And so because of that, I needed to buy lots of equipment and all this stuff to make it sort of match the business model that I had already. And I forgot that it's actually a new practice, even though it's another side of town, even though it's really just a second location of my existing practice, that it's going to take time to grow. And when you have all of this equipment and all of this overhead, and it was in a little wealthier part of town, so rent was high, we couldn't support it. And I saw the writing on the wall there that, it could impact the success of my pre-existing business, and I didn't want that to happen. So I had to pull the cord on that and went through a whole bankruptcy, and it was horrible. But I always feel like you got to take something good, positive from it. And I think what I took was that, you can be really successful and be really small and just focus on what you're passionate about. And in the case of cosmetic medicine, oftentimes for new providers, that's cosmetic injectables. And you can do that out of a single room, and you can be a one-man band. You can do it yourself, so you don't even have to have staff. Like I said, that's a headache in and of itself. And you can, if you had support, like I had support, I had the luxury of having support in opening my practices in the beginning. I think a lot of these newer injectors, they don't have that support. They don't know how to make forecasts and determine KPIs for their practice and things like that. They don't understand all of that because we're not taught that, unfortunately, when going through medical training. And so I thought, well, if I could provide that support for these folks, and clinical mentorship and marketing support and all of these things that would allow them to focus on becoming excellent injectors, then, we can essentially grow this business model under the name of Tonic. So we provide a licensing agreement to our partners to allow them to operate under the Tonic name, but really they own the practice themselves. So it's not a franchise per se, but we're behind the scenes providing all of that support for them to be successful. So that's kind of like, I'm thinking, okay, well, I'm going into my, later career years and having to think about what that's going to look like for myself. Am I going to be just the one providing services all the time, or could I take up more of a backseat role? And I think as I age, I think that's probably where I would like to go. And so this is just my forward thinking of my exit strategy for my own clinical practice. But I don't see myself really retiring for quite a while, though. I mean, I just turned 50, so I've got a few years left. But that's something I could do for quite a long while, right? Like, I don't have the demands of patient care, but I would love to be able to collaborate and work with other providers. And I think it's really sorely needed in this industry. I think a lot of aesthetic providers are all about mine. I don't want to share information, and I don't want you to be better than me. And I've never been like that. I'm not. It is a competitive industry, but I always feel like if you're doing really good work, you're going to be successful. If you're really passionate about it and you prioritize education for yourself, then I think you can be successful even if there's somebody doing the same thing down the street. So, and I've had nurses that have worked for me and have opened their own business right up the road, and it's okay. There's enough patients to go around. There are enough, and this is a growing field. There's going to be more and more patients to treat. So don't worry about what everybody else is doing. Worry about what you're doing. So yeah. So anyway, that's how Tonic came about, because I just thought, well, what would I really like to do kind of moving forward? And what it is I would like to enjoy other people's success.
Yeah, I think it's actually a great summary. Again, just for how you said time-wise, I know, about 10, 15 minutes. I definitely think based on our conversation, this one and previous conversations, I definitely don't think you're the type of person who's going to stop working altogether. I think if they had half a dozen projects going on, I think you'd get more.
Yeah, I would. I do. I get antsy. I do. And that's a problem. I need to stop getting so antsy. I need to That was part of it too. Like, I don't want to own another business, but I'll help you another business, right?
I want to,
So,
want to help dozens of people open this.
yes, I've gotten to that point in my career, like, oh no, I'm not going down that road again. But I'm more than happy to provide, my mentorship, I can tell you the good, the bad, the ugly, and otherwise what to do, what not to do. I'm happy to share. And I'm happy to share with people who really aren't even wanting to open a toxin tonic, quite honestly. So like with Toxin Tonic, we actually do have what we call our starter package, and we have our partnership package. So starter package is for providers who may just be contemplating business ownership. They may have a cosmetic practice of their own already, and they don't want to go, license themselves under the name of Toxin Tonic. They maybe already have a website and all of that stuff going, but they are lacking support, and maybe aren't seeing the successes, the fruits of their labors as quickly as they would like. And so we do provide an option for those folks. I have put together a whole playbook for cosmetic injectors that they can follow, and we also included in that is some time that we will actually spend with them, just sort of figuring out where they are and giving them guidance on where they could take their practice to become more successful in the future. So we provide that like a business consultation as well. And then we also provide to both members and, partners and non-partners an opportunity to jointly purchase supplies, which helps all of us, right, to lower our cost of goods, to become more profitable in that way. So that's something that we do as well.
Nice. And then the future of Toxin Tonic, just to round up with that, what do you see, what does the future look like? What do you see, say, 3 years from now, 5 years from now? What does that look like?
Well, right now we're looking to partner with really hungry injectors, right? Really motivated injectors that are, again, we vet all of our injectors before we work with them as a partner, because we want to be able to say that, like Toxin Tonic, we have the best cosmetic injectors. We don't want, people who are not knowing what they're doing yet from a clinical standpoint. So they don't need to know all the business stuff because we can help them with that. But we're looking to partner with excellent injectors in the field. And right now we're focusing mostly on Arizona. We are in the works opening. We have 2 locations that we started with. We are about to open a third and possibly one in southern Arizona near the Tucson area. So we're looking to expand our footprint into Arizona, and then we'll start looking at other states. Probably Texas would be our next. We've got our sights on Texas because one of our business partners lives in Texas. So, but there's legalities about all these things too, and who can be a medical director for a nurse injector, and that varies by state. So, but eventually our goal is to make Toxin Tonic a household name, so that people will recognize it as a place to go for excellent cosmetic injectable services. And that's going to take time, but we've got the time and we're just waiting for the right people.
That's brilliant. Before we ask again where they can find you, one final, let's say just one bit of advice, or maybe someone, just so people can get a little glimpse, a little sprinkle of the business advice that they'll be getting when they join Toxin Tonic. Do you have any random snippets of advice for someone that, for some of the common challenges that injectors may have, managing seasonality, some quick hacks for improving the patient experience, and so on?
I think my piece of advice would be not to worry so much about getting new patients. I think everyone thinks like, oh, I need more patients. Optimize your chair time with your patient. So every patient is there that you have the opportunity to educate them on services that would value them. And I think sometimes we fall into the it's like a pitfall where someone comes in, what are you concerned about? Okay, I'm concerned about my 11th. And then we're just focusing on, okay, I think you need 20 units of Botox to treat your 11s. When we should be doing a full assessment, a full facial assessment on every patient that comes to us, because really what they're looking for is they want to feel better. They want to look better and feel better about themselves. And just fixing the 11s may not help them feel better about themselves or look better. So you're doing them a disservice if you neglect to mention all of the other things that you feel like could benefit them. They may not agree to do all of them, but, and that includes skincare even. Like, patients are buying skincare. They're buying it at Nordstrom or wherever they're going. They're buying it at Sephora. Their 13-year-olds are buying it at Sephora if they're not. So that's a big problem here, is that we've got Instagram and TikTok and all these things telling you what to buy. And so rather than letting TikTok tell them what to buy, you're the expert. And so don't be afraid to mention, and, you need to do your homework. We can only do so much in the office, but I'm recommending product X because I really feel like it has the active ingredients that you need to help address some of the sun damage, or in a very minimum, giving them a really great sunscreen. We all need a great sunscreen. We should be wearing it every day. If they walk out of your office without those recommendations, again, whether they buy them today, they may just think about it and do it next time, but you're doing them a disservice for not mentioning it. And I think that is one thing I do see with newer injectors, is they're not as comfortable having those conversations with patients, again, because it comes down to money. You don't want to seem like you're trying to sell. But rather than worrying about new patients, worry about the patients that are sitting right there. They're already in your office, and getting them to consider all of the treatment modalities that you have to provide for them, as opposed to just coming and treating them with the one thing that they thought they needed. And that's, you can increase revenues and you can increase patient satisfaction.
I love that. I think we'll leave it at that. That was amazing, Rebecca. Where can people find you to learn out more about it?
So I've got a few websites you can visit.
I'll link them all in the description.
Yeah, so you can link those, but you can find me on Instagram at SpaDocAZ is probably the easiest way to reach out. And you can message me if you're interested in Toxin Tonic or any of my other business ventures. Happy to share information.
Perfect. I'll link to any of the websites, Toxin Tonic, Paradise Medspa.
My LinkedIn on there. They can reach out to me from LinkedIn, but I get a ton of messages on LinkedIn, so sometimes it's kind of hard to sift through all of that.
Perfect. So Instagram might be better for people?
Yeah, I think so. Yep.
Perfect. We'll leave it at that. Thanks so much, and I look forward to hopefully doing this again soon.
Okay. Thank you.